high-profile, high-yield questions focused on Gaucher disease, covering the clinical features, enzyme deficiency, substrate accumulation, and treatment. Question 1. Clinical presentation and histology. A 7-year-old child presents with chronic fatigue, easy bruising, enlarged abdomen, and limping due to bone pain. Physical exam reveals massive hepatosplenomegaly. Bone marrow biopsy shows lipid-laden macrophages with a crumpled tissue paper appearance. Which of the following enzyme deficiencies is most likely? A. Aryl sulfatase A, glucocerebrosidase beta-glucosidase, C. Hexosaminidase A, D. Sphingomyelinase, E. Alpha-galactosidase A. Correct answer, B. Glucocerebrosidase A. Explanation. Gaucher disease is the most common lysosomal storage disorder caused by glucocerebrosidase deficiency, accumulation of glucocerebroside in macrophages. Classic features: hepatosplenomegaly, pancytopenia, osteonecrosis of the femur, Gaucher cells in bone marrow, macrophages with wrinkled cytoplasm. Why not the others? H equals metachromatic leukodystrophy, C equals Tay-Sachs, D equals Niemann-Pick. Question 2. Musculoskeletal manifestations. Which of the following is a classic skeletal complication seen in patients with Gaucher disease? A. Erlenmeyer-Flask deformity and avascular necrosis of the femur. B. Subperiosteal bone resorption and Brown tumors. C. Kyphoscoliosis and vertebral fractures. D. Macroglossia and rib notching. E. Osteoid matrix accumulation and rachitic rosary. Correct answer, A. Erlenmeyer-Flask deformity and avascular necrosis of the femur. Explanation. Gaucher disease affects the bone marrow and long bones, causes bone crises, osteoporosis, Erlenmeyer-Flask deformity of long bones, and avascular necrosis, particularly of the femoral head. Why not the others? Equals hyperparathyroidism, C equals osteogenesis imperfecta, D equals thalassemia or Pompe disease, equals rickets, vitamin D deficiency. Question 3. Treatment and pathophysiology. Which of the following treatment options directly targets the underlying enzyme deficiency in Gaucher disease? A. High-dose corticosteroids, B. Bone marrow transplant, C. Recombinant glucocerebrosidase enzyme replacement, D. Vitamin B6 supplementation, E. Dietary elimination of galactose. Correct answer, C. Recombinant glucocerebrosidase enzyme replacement. Explanation. Gaucher disease is treated with recombinant enzyme replacement therapy using glucocerebrosidase, reduces accumulation of glucocerebroside in macrophages, alleviates organomegaly and bone symptoms. Why not the others? A equals symptomatic, not curative. B equals considered for severe cases, but not first line. D equals used in homocystinuria, not Gaucher. E for galactosemia, not Gaucher. Would you like a quick flash?